Hello everyone. In this video, I'm going to talk about Montelukast. Montelukast is a medication well known by its brand name, Singulair. It is a leukotriene receptor antagonist. It can be used for the prevention of attacks of asthma. It can also be used for the treatment of allergic rhinitis or seasonal rhinitis that causes an itchy nose, itchy eyes, sore throat, and nasal congestion. This video covers a few important facts about this medication, like how it works, when to take this medication, what its effect is on mental abilities, and what precautions and side effects are to be noted. How this medication works. Montelukast works by reducing inflammation in your lungs. Many chemical mediators are involved in setting inflammation in the lungs. Few cells like basophils and mast cells release inflammatory mediators that induce an allergic response. Few mediators are released from cleavage of lipid membranes due to allergic response. One among them is the leukotrienes. Montelukast blocks the activity of these leukotrienes, limiting inflammation. It specifically blocks the receptors for leukotriene D4. This results in the prevention of bronchoconstriction and relieves the symptoms of allergic rhinitis and asthma. How to take this medication? You can get Montelukast as tablets, a strength of 10 milligrams. For use in children, it is also available as chewable tablets. They are available at 2 strengths for milligrams and 5 milligrams. You can also get Montelukast granules with each sachet containing 4 milligrams of the medication. You may be given Montelukast as a prophylactic. That means it prevents recurring attacks of asthma. In such cases, it is given at a dose of 10 milligrams once daily. It is recommended to be taken in the evening. Check before taking any other combinations that contain Montelukast. It can be combined with another group of medications called antihistamines. One of the most widely used combinations of Montelukast is with levocetirizine. Levocetirizine is an antihistamine that can reduce allergic response by blocking the actions of histamine. Montelukast blocks the actions of leukotriene. This combination can act by a dual mechanism to reduce allergic response. This combination is available as tablets and syrup. The maximum dose of Montelukast is 10 milligrams per day. Never take more than the dose recommended. The dose of Montelukast in the children depends on their age. Your doctor suggests the right dose for your children. You can take Montelukast tablets either with or without food. It is recommended to be taken in the evening, especially when combined with antihistamines. However, in a few other situations, Montelukast can be taken at any time of the day. If Montelukast is given to you for exercise-induced bronchospasm, it should be taken at least 2 hours before the exercise. You can also be given Montelukast at a 10 milligrams dose for treating allergic rhinitis. In the children, the dose may be variable from 4 to 5 milligrams based on their age. Where is it ineffective? Montelukast is not suitable for treating aspirin-induced bronchospasm. Many painkillers, including aspirin, can induce bronchospasm in a few people sensitive to these medications. It may involve a variety of mediators and complex mechanisms. Montelukast is not a direct bronchodilator, and it cannot relieve this condition. Therefore, try to avoid aspirin or other NSAIDs if you are sensitive to these medications. If you're sensitive, never take aspirin for treating fever while using Montelukast. It may increase the bronchospasm. Alternatively, you can take antipyretics like paracetamol to control the fever. Montelukast is not suitable to relieve acute attacks of asthma. Therefore, to relieve bronchospasm and wheezing, you shouldn't rely on this medication. Montelukast is not a direct bronchodilator. It prevents the setting of bronchospasm induced by leukotrienes. Therefore, it can't reverse once an asthma attack is induced. To relieve your symptoms of asthma, you can use bronchodilators like salbutamol or salmeterol. They are beta-2 agonists that induce immediate bronchodilation. They are available as oral inhalations and quickly produce relaxation of bronchial smooth muscle. In a similar way, Montelukast is also ineffective in serious conditions like status asthmaticus. However, you can use Montelukast along with other bronchodilators for preventing recurring attacks of asthma. What are the important precautions? Even though rare, Montelukast can produce a few of the neuropsychiatric effects. Therefore, you should monitor any unusual changes that happen to you while using this medication. You may have an unexpected increase in the agitation and anxiety. You may feel nervous and confused. It can also increase aggression and disorientation. You may also have loss of memory. Restlessness, irritability, and difficulty sleeping can also be observed. These central effects may be observed even in the absence of pre-existing psychiatric disorders. Therefore, try to monitor changes in your thinking and behavior, especially when this Montelukast is used for the long term. Never stop using corticosteroids suddenly while you are taking Montelukast. This may result in the development of a condition called eosinophilia. Normally, corticosteroids reduce inflammation in your body. When they are suddenly stopped, it may enhance stimulation of inflammatory pathways. It can significantly increase eosinophil count in your body. With this, you may have increased cough and difficulty breathing. You may have a stuffy nose and wheezing. It can also produce skin rashes, fatigue, and weakness. Even though it is not clearly linked with Montelukast, a sudden withdrawal of corticosteroids may induce this condition. Chewable tablets of Montelukast are used in the children. It may contain an amino acid called phenylalanine. In children with phenylketonuria, these tablets are not suitable. It is a genetic disorder where phenylalanine is not broken down properly in the body. This can lead to an accumulation of phenylalanine that significantly affects their mental abilities and increases hyperactivity. What are the side effects? Many of the side effects of Montelukast are mild. You may get a headache and abdominal pain. You may have indigestion and even diarrhea. Fever, skin rashes can also be observed. You may have ear pain and dizziness. Nasal bleeding, sore throat, and difficulty swallowing may also be observed. These are the few important things that should be known before using Montelukast. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.